So like if you feel like you're about to fart, right?
Okay.
And you're going to stop it.
I'm familiar with
Like
the feeling.
that is one version of a pelvic floor exercise.
Okay,
Like,
so it's like holding your muscles.
yeah.
What's going on, everybody? Welcome back to Uncomfortable Questions. I'm your host, JC Mendoza, back again with my favorite board-certified urologist and SVP of Men's Sexual Health, Dr. Peter Stahl. Doctor, it's amazing to see you again.
Do you know any other board-certified urologists?
I don't, but I also don't appreciate you trying to lessen the gratefulness that I have to be sitting here with you, because you are, if I did know other ones, I would not like them half as much as I like you.
Well, I'm psyched to be your number one, and I'm psyched to be here, and I can't wait to hear what we're going to talk about.
Me neither, and that's why I want to jump right into it. Dr. Pete, in your opinion, can pelvic floor exercises help with erectile dysfunction?
Oh, wow, we're going to get right into it.
Got to get right into it.
Okay, pelvic floor exercises, ED. The answer is maybe.
Maybe.
Right? So to be honest, I was skeptical about this for a long time, but I've kind of familiarized myself with some research this happened over the last couple of years. And it turns out that there are some well-designed, relatively high-quality studies looking at pelvic floor physical therapy, so ways to make the pelvic floor healthier, either by helping it relax more or helping it get stronger, and the impact that has on sexual function, in particular erections and ejaculatory control. And it turns out that the evidence is pretty clear that for some people with ED or PE, pelvic floor therapy can really be helpful.
May I ask you what the pelvic floor is?
Yeah, so the pelvic floor is a set of muscles that's kind of like a hammock that separates the pelvis from the outside world. And they go from kind of your tailbone or the coccyx to the underside of the pubic bone.
Okay.
It's a bunch of muscles, and the pelvic floor itself is not just muscles, it's muscles and nerves and connective tissue, and plays a really actually important and largely underappreciated role in human physiology.
So we talked about how strengthening the pelvic floor can definitely help with ED, but how can you, what's a way that you could possibly weaken the pelvic floor? What's something that could happen that would weaken the pelvic floor?
Yeah, so sometimes those muscles get too tight, especially people that are like type A people that are really anxious and tense. Sometimes all that tension goes right to the pelvic floor, and that can cause pain. It can cause problems with urinary function, and it can actually cause problems with sexual function because a lot of like the blood vessels and nerves that have to get to the penis go right through the pelvic floor. So if it gets too tight, that can be an issue. So things like, anxiety, that sort of stuff.
Yeah.
But then it can get too weak also, right? And weakness can result from surgery, just from getting older.
Yeah.
If you're overweight, sort of a lifetime of your pelvic floor having to support the extra weight can kind of stretch things out and make it a little weaker. So those are the things that can affect pelvic floor tension and weakness.
Could you speak to that role that the pelvic floor plays and why exercising your pelvic floor could prove beneficial, as it pertains to erectile dysfunction?
Yeah, so to simplify it, when I think of the pelvic floor, I think of bowel, bladder, and sex.
Bladder,
sex. Pelvic floor muscles play important roles in control of bowel function, control of bladder function, and an increasingly recognized important role in erections and ejaculation, so sexual function.
Got you. So absolutely very important. And what would an example of a pelvic floor exercise, or how do you do pelvic floor exercises?
Yeah, so the details are really important. So most people have heard of Kegels, right? And that's like the basic pelvic floor exercise.
Okay.
But figuring out how to really do a Kegel right or to do other pelvic floor exercises is in the best case scenario, something that you learn with a specialized physical therapist who can monitor contraction of the pelvic floor muscles. But there are a couple of things you can try to do, and they're sort of maybe kind of fun exercises to try. You might like them.
Yeah, what would one exercise be that I could do?
So if you feel like you're about to fart, right?
Okay,
and you're going to stop it.
I'm familiar with the feeling.
That is one version of a pelvic floor exercise.
Okay, so it's like holding your muscles.
Okay. And what's good about that, as ridiculous as it sounds, is that almost everybody on earth, I'm going to say probably everybody, has the experience of trying to hold back in that way.
Yeah.
So figuring out what that feels like and then how to voluntarily activate those muscles outside of flatulence is a big way to exercise your pelvic floor.
That's the key to success.
Right.
So it sounds to me like it's like an exercise in restraint, kind of. like in holding back and turning that restraint into strengthening your pelvic floor.
Yeah, that's exactly right.
Oh, that's exciting. That's good. All right, so we talked about weakening the pelvic floor. We talked about how it can help ED. What are some ways to treat ED without doing pelvic floor exercises?
So, of course, if pelvic floor therapy doesn't work to support erectile function, there's really, the traditional treatments, oral, FDA-approved, compounded or generic medications like Viagra, Cialis, and the generic versions of those are super effective, and we treat a lot of people with those through HIMSS. And then there are more advanced treatments like injections and surgeries. But, all of those things need to go through an appropriate healthcare provider like me or somebody else.
And that's good. And I don't know if this is uncomfortable for you to hear, but I've done like 3 pelvic floor exercises since you explained them.
I was wondering about that.
I'm doing a couple right now,
Yeah.
Dr. Pete.
Yeah.
I'm doing great, and I feel appreciative of your explanation, and I feel appreciative of all of you guys for watching. Thank you so much. This has been Uncomfortable Questions. We have plenty more for you, so remember to like, subscribe, and follow for more.